In the last recording, we looked at the first joint of the lower limb proper, the hip joint. Now we will be discussing the knee joint. The knee is the largest joint in the human body, and it's also the most superficial. You can palpate almost the whole thing. The knee is a synovial joint, and it acts like a hinge, allowing the joint to move almost exclusively in flexion and extension. But the knee can make some other relatively small medial and lateral rotations, seen here. These are best seen when the knee is bent. Let's return now to our bones. For such an important joint, allowing us to walk and sit and stand, it is surprisingly weak, and this is in part due to the wide range of permitted flexion, and partly because of the inherent instability of having curved surfaces of the femoral condyles sitting on the flat tibia. The knee joint is kept stable by the ligaments and tendons which attach the femur to the tibia, and by the muscles surrounding it. Although actually relatively little muscle mass is part of the knee, these provide the majority of the support. The straight or erect knee position, extended here as we see it, is the most stable position of the knee joint. Think of standing. You don't tend to wobble. The knee is basically locked. Externally, the joint capsule is strengthened and supported by three major ligaments: the patellar tendon, the medial collateral ligament, and the lateral collateral ligament. On a side note, the synovial patellofemoral joint is considered part of the knee, but we're focusing more on the basics here. The patellar ligament is the continuation of the quadriceps femoris tendon, and it's the most anterior ligament of the knee joint. When the knee is erect, the two collateral ligaments are tensed, providing strong support to the joint. As the knee bends, they loosen and release, and this is what allows for the small amount of medial and lateral rotation I mentioned earlier when the knee is bent. So the two collateral ligaments are first the more rope-like lateral collateral ligament. This is also known as the fibular collateral ligament, obviously because it sits on the lateral side and it runs from the femur at the lateral epicondyle to the fibula, hence its other name. This is a really important key concept here. Although this ligament attaches here, the fibula itself is not considered a bone of the knee joint. The second ligament is the medial collateral ligament, also known as the tibial collateral ligament. Now, unlike its counterpart, it's really flat and more like a band, and it runs from the medial epicondyle of the femur to the tibia. Inside of the joint capsule, we have the cruciate ligaments and the menisci. Remember, cruciate is Latin for cross, and that's exactly what the cruciate ligaments do. They cross each other within the joint capsule, but outside of the synovial cavity. This is best seen from above, as we're looking here. When the knee is bent or flexed, as I mentioned, the collateral ligaments become slack, so it's the cruciate ligaments that are vital for holding the femoral and tibial articular surfaces together. A key concept here is that the cruciate ligaments are named for where they originate on the tibial plateau. Therefore, the anterior cruciate ligament, commonly known as the ACL, arises from the tibia at the anterior intercondylar area, seen here. Whereas the posterior cruciate ligament, or PCL, arises from the posterior intercondylar area. The articular surface of the tibia are two crescent-shaped plates of fibrocartilage, the medial and lateral menisci, and these partly act as shock absorbers. And that's it. That's the knee.